So that fibrotic membrane actually can often be peeled from away from the inner surface of the anterior capsular edge. And here, look at that. Wow, it's a pretty still reasonable looking rexus. I like it a lot. Now, because it's a brunescent cataract, I'd make a nice, juicy, generous, big rexus. But wow, that is fantastic. Sometimes it's not that easy. You're obviously a great surgeon. I appreciate the video. You're doing a beautiful job there. Let's get that finished. If it does get stuck, sometimes you're going to have to just cut it. Now, look at that. There's the whole fibrotic membrane. Whoa. Capsule rexus is done. Now, look at the whole membrane can be peeled off. Look at that thing. Whoosh. Yeah, I pull that out of the eye. Give that to the patient for a souvenir. Now, a little bit of hydro dissection. Can you get that thing out of the eye? It's kind of irritating me. Now, let's see what we got here. It's definitely brunescent. Looks like zonules or have reasonable support there. Doesn't look like too much zonulopathy. I just grab that with forceps. Just grab with the forceps and kind of yank it out. Okay, I like the viscoelastic, but just grab that thing. Don't leave it there. I just pull it out with forceps. I wouldn't even ask for it with a phaco probe. Now here, you're going to do the phaco probe. Whatever you like, you teach me. Now, okay, you want to buzz into this thing? Look at that big gooey thing. Buzz into that thing. Let's see if we can get rid of it. Sometimes it may just clog up your tip even. Sometimes it won't break up with ultrasound. That's why I would have just grabbed it with the forceps and yanked that thing out of the eye. Just yank it. But I guess you can buzz into it and just kind of wolf it down. There you go. Okay, it's gone. It's gone. Now it looks like a sharp chop on the left hand, so maybe a vertical chop technique here. Let's see what we're going to do here. Maybe, let's see, a little bit of a groove. Okay, maybe like a submarine chop. We've seen that before. No? Okay, maybe groove down the middle, maybe a stop and chop. You can debulk that center part of the nucleus is the densest part, as you know. So, okay, debulking it. I like that. There's the split. Beautiful split, by the way. Nice looking stop and chop. And now let's see. Yep, look at that. Nice, clean chops. I like how you use the wall of the groove to bury the phaco tip in the meat of the nucleus. That's really smart. If you're a young student and didn't quite get that, go back and watch it again. That's really smart. And so rotating here again, buzzing. Look where the probe's going to go. It's going to go in the deeper, meatier part of the nucleus before you do the chop. That's great. You have great technique here. Fantastic. And now let's see. Take these pieces down. Wow, how happy is this patient going to be? And how happy is the surgeon? What a fun case. Don't you love a fun challenge case like this? We all love a good challenge. That makes it fun. It keeps your day interesting. Now you got half the nucleus out. There's the other half in the capsular bag. Get that thing rotated around. There it is. And buzz, buzz, buzz. Yup. And there's the chop again. So you're very handy with the vertical chopper. Now probably switching over to a blunter instrument. Yep. There you go. More viscoelastic. I like that. Smart. Recoat the endothelium with viscoelastic, more dispersive agent in there. Now back to your sharp chopper. Okay. I like that. Viscoelastic is cheaper than endothelial, so that's for dang sure. Now aspirate and fake it down these little quadrants there. Yep, the air bubbles are like champagne. It's free. Don't worry about it. Get rid of those pieces. And now you got the one quadrant left in the bag. And now remember, the bag is empty other than that quadrant. There's no cortex. There's no epinuclear shell. Nothing's weighing down the bag. So when this last piece comes up, be careful because the bag can be floppy. If you don't have great fluidics, sometimes that bag can be very floppy. And so you want to keep that chopper, I'd keep it in what I call the safe position when the last pieces are coming up. And that means the smooth back end of the chopper is towards the posterior capsule, just to prevent the capsule from coming up. You never know. I don't want to risk anything. And then slow motion. These last few pieces, slow. Take it easy. As Osher says, slow motion phaco sometimes is the best thing for you. Look at that. Wow. Finally, some light gets to go shine on the retina.